Bell's palsy is a neurological condition characterized by sudden, temporary weakness or paralysis of the facial muscles, typically affecting one side of the face. It occurs due to inflammation or compression of the facial nerve, cranial nerve 7, which controls the muscles responsible for facial expressions. Named after Sir Charles Bell, the Scottish anatomist who first described it, Bell's palsy can affect anyone, regardless of age or gender, though it is more common in people aged 15 to 60. Symptoms. The hallmark symptom of Bell's palsy is the rapid onset of facial muscle weakness or paralysis on one side of the face. This weakness can range from mild to severe and may include the following. Facial drooping, the affected side of the face may appear droopy or stiff. Difficulty with facial expressions, activities such as smiling, frowning, or closing the eye on the affected side may be difficult. Drooling, inability to control saliva due to weakened facial muscles. Loss of sensation, some individuals report numbness or a heavy feeling in the affected area, though sensation remains intact. Pain or discomfort, mild pain around the jaw or behind the ear on the affected side is common. Changes in tear and saliva production, some may experience dry eyes or excessive tearing, as well as dry mouth or increased saliva. Altered taste and hearing, a reduced sense of taste and sensitivity to sound, hyperacusis, may also occur. Symptoms typically develop quickly, reaching their peak within 48 hours. In most cases, they improve within weeks, though recovery times can vary. Causes. While the exact cause of Bell's palsy remains unclear, it is believed to result from inflammation or swelling of the facial nerve, often linked to viral infections. Viruses associated with Bell's palsy include herpes simplex virus, HSV, responsible for cold sores. This is the most commonly linked virus. Varicella-Zoster virus, causes chickenpox and shingles. Epstein-Barr virus, associated with mononucleosis. Cytomegalovirus, commonly infects people of all ages. Influenza virus and adenovirus, linked to respiratory infections. Other contributing factors include diabetes, high blood pressure, pregnancy, especially during the third trimester, and upper respiratory infections. Diagnosis. Diagnosing Bell's palsy is primarily clinical, based on the patient's history and symptoms. Since other conditions, such as stroke or tumors, can mimic facial paralysis, it's important for healthcare providers to rule out these possibilities. Diagnostic approaches may include physical examination, assessing facial muscle strength and movements. Imaging studies, MRI or CT scans may be performed if a more serious underlying cause is suspected. Electromyography, EMG, evaluates the electrical activity of facial muscles to determine the extent of nerve damage. Blood tests, these can identify infections, diabetes, or other contributing factors. Treatment and management. Treatment for Bell's palsy focuses on reducing inflammation, managing symptoms, and promoting nerve recovery. Most people recover fully without medical intervention, but certain treatments can accelerate recovery or prevent complications. Medications. Corticosteroids, prednisone is commonly prescribed to reduce inflammation and swelling of the facial nerve. Antiviral drugs, if a viral infection is suspected, medications such as acyclovir or valacyclovir may be prescribed, though their effectiveness is debated. Eye care. Individuals with Bell's palsy often struggle to close the eye on the affected side, increasing the risk of dryness and corneal damage. Artificial tears, lubricating ointments, and protective eye patches can help. Physical therapy and exercises. Facial exercises and massage may help improve muscle strength and coordination during recovery. Pain management. Over-the-counter pain relievers like ibuprofen or acetaminophen can alleviate discomfort. Surgical intervention. Rarely, surgery may be considered for individuals with persistent symptoms or significant facial nerve damage. Prognosis and recovery. The prognosis for Bell's palsy is generally excellent, with most people experiencing significant improvement within 3 weeks and complete recovery within 3 to 6 months. However, recovery may be slower or incomplete in some cases, particularly in individuals with severe nerve damage. Factors that may affect recovery include age. Older individuals may take longer to recover. Severity of paralysis. Those with total paralysis may face a slower recovery process. Underlying health conditions, diabetes or hypertension can impact recovery outcomes. In rare instances, residual effects like facial asymmetry, involuntary muscle spasms, or synkinesis, involuntary movement of muscles, may persist. Complications. Although rare, complications of Bell's palsy may include permanent facial weakness. Incomplete nerve regeneration can lead to long-term weakness. Abnormal facial movements, uncoordinated or involuntary muscle movements can occur. Eye damage. Inadequate eye closure can result in corneal ulcers or infections. Prevention. Since the exact cause of Bell's palsy is unknown, there is no guaranteed way to prevent it. Maintaining good overall health and promptly addressing viral infections may help reduce risk. Conclusion. Bell's palsy is a relatively common condition that can be distressing but is usually temporary and treatable. Prompt medical attention, proper care, and patience are key to recovery. Advances in medical research continue to provide insights into its causes and treatments, ensuring better outcomes for affected individuals.
Thank you for watching. Please subscribe our channel.